For an uncuffed endotracheal tube, the formula to estimate the correct tube size is age in years divided by 4 plus 4. For example, for a 2-year-old child, we put 2 in place of age in years. 2 divided by 4 equals 0.5 and adding 4 gives us 4.5. So, the appropriate uncuffed endotracheal tube size would be 4.5 millimeters. Now, for a cuffed endotracheal tube, the formula is age in years divided by 4 plus 3.5. Let's talk about general adult tube sizes. For females, the usual cuffed ETT size is 7 to 7.5 millimeters, and for males, it's typically 7.5 to 8 millimeters. Next, the length of the endotracheal tube. A simple way to remember this is tube length in centimeters equals 3 times the tube size. For example, if the tube size is 3 millimeters, then the length would be 3 times 3, which equals 9 centimeters.